All right, well, welcome everyone to NIAMRRE's December Member Spotlight featuring Krista Gens, who's the NIAMRRE Advisory Council representative for the Society of Infectious Diseases Pharmacists. I'll introduce Krista here in a minute, but before I do that, we will go through a couple housekeeping items. So we're using Zoom webinar format for today's presentation. That means your audio line is muted. We'll take questions at the end of Krista's presentation, and you're welcome to enter your questions as we go through into the Q&A function at the bottom of your screen. We're recording this webinar and we'll post it to NIAMRRE Exchange later this week, and slides won't be available after the webinar. And so it's my pleasure to introduce our speaker, Krista Gens. She's the System Antimicrobial Stewardship Program Manager at Allina Health and the PGY2 ID Residency Program Director at Abbott Northwestern Hospital, which is part of Allina Health, and both of these are in Minneapolis, Minnesota. She's a board certified in pharmacotherapy and infectious diseases, and she completed the ASHP's Pharmacy Leadership Academy. She's been an infectious diseases pharmacist for over 13 years, and in her current role, she is collaborating with partners across the system to cast a vision for the future of antimicrobial stewardship, capitalize on new opportunities, and drive change to positively impact patient care. Professionally, she's active in the Society of Infectious Diseases Pharmacists, or SIDP, NIAMRRE, and the Minnesota One Health Antibiotic Stewardship Collective. So I'm going to stop sharing my screen and turn it over to you, Krista, for your presentation. Again, welcome and thank you for joining us today. Oh, Krista, I think you're muted.
Thank you so much. Just 1 second while I will get up my PowerPoint here. Okay, everybody can see that okay?
Yep, that looks great.
All right. Well, thank you again for inviting me here today. It's a really pleasure to speak with you all today about infectious diseases pharmacists, some of which you might not be familiar with. But I'm going to be talking about why we may be the pharmacist you didn't know you needed, but the one you can't live without. And as mentioned, my name is Krista Gens, and I'm based here in Minneapolis, Minnesota. And I'm going to be talking about infectious diseases pharmacists in general, but also talking about the broader Society of Infectious Diseases Pharmacists, for which I represent them on NIAMRRE's council. So for those of you that are less familiar, I'm just going to go into what does it mean, or how do you become an infectious diseases pharmacist? And there are multiple avenues in which someone could enter the field of infectious diseases pharmacy. In general, in order to get into pharmacy school, you need at least 2 to 4 years of pre-pharmacy coursework. A lot of applicants into pharmacy programs will have an undergraduate degree, but not all of them will. Although typically you will obtain an undergraduate degree in pharmacy school. When you go into pharmacy school, that is a 4-year doctorate of pharmacy program. And from there, some people could potentially go into an infectious diseases pharmacist professional practice. They typically would do that by taking a certificate course. So there are several organizations that have certificate courses on antimicrobial stewardship, and that would be the most common avenue or position a pharmacist might go to right after school. And SIDP has a stewardship program, or a stewardship program certificate, I should say, and that helps really train up pharmacists that maybe are filling a need in an institution or a health system that might not have readily available an infectious diseases trained pharmacist, or even potentially an infectious diseases trained or antimicrobial stewardship trained physician. However, most pharmacists that enter into an infectious diseases pharmacy career will then go into a postgraduate year 1 residency, and that is a 1-year general practice residency. Typically, this is in a hospital or health system. And so this is on the inpatient side. And I would say that's in general where most infectious diseases pharmacists work, is on the inpatient side. But there is a lot of expanded growth in the outpatient side as well, and ambulatory care. And so just keep that in mind, that most infectious diseases pharmacists are going to work in the hospital, but there are other avenues as well. That first year residency is a general residency of all aspects of hospital practice, and then moving into the second year is when you then specialize in infectious diseases. After that, that is most commonly when a pharmacist would be able then to obtain a position as an infectious diseases pharmacist or an antimicrobial stewardship pharmacist. There are some pharmacists, though, that then go on and do 1 to 2 years of fellowship. And that typically is more on the academia side or research side. So either doing clinical pharmacology research or that kind of focus. And then they may enter into professional practice as an antimicrobial stewardship pharmacist, or they might stay on that academia side or go into industry. But either way, there is that additional training that some pharmacists will receive via fellowship. All of these pharmacists, whether or not you go through a second year, first year, or fellowship, depending upon the criteria, you would then be eligible to sit for the board certification in infectious diseases pharmacotherapy exam, and that's shown there on the right. So I'll talk about my career path a little bit, but I went through the career path of going through the PGY2, and then I was in professional practice for a while. Then I sat for the BCIDP exam. And that one I would say would probably be the most typical trajectory of an infectious diseases pharmacist and how someone becomes an infectious diseases pharmacist. And I think one thing I want to point out here too is that this may be not what you initially think of when you think of pharmacists. A lot of you, when you think of pharmacists, think of pharmacists that work in outpatient or retail and work in CVS or Walgreens and are dispensing medications. Or you may think about ID, or you think about pharmacists as really focusing on dosing and drug interactions, which I think that is a part of this, but there's a much bigger scope that an infectious diseases pharmacist will have, and yet an also much narrower scope in that they're really focused just on infectious diseases. So that brings me to, well, what exactly is an infectious disease pharmacist? When you get to that career path, what does that look like? And I would say, first and foremost, infectious diseases pharmacists are stewards. An infectious diseases position is most commonly going to include some sort of antimicrobial stewardship right within the job description. If you look at a lot of the statistics nationally, antimicrobial stewardship programs are most commonly either led or co-led by a pharmacist. And this is really where infectious diseases pharmacists take up the role of stewards. And we're taking that role not only on a daily basis, but also as a global perspective, especially for someone in a position like mine, where I am the program manager for the health system. I'm looking at the broader goals, with the ultimate goal, though, being the safety and the positive patient outcomes. Now, the other thing that I don't think people always recognize pharmacists are educators, and we serve a critical role in the education of all disciplines in healthcare. A lot of us provide recurring and regular education to not only ID providers, keeping them up to date on the most recent literature published, and helping apply and drive institutional guidelines, but we also provide education to our fellow pharmacists. We provide education to other healthcare providers. We provide education to nurses, and we even help develop education for the public or our patients. And so pharmacists play a critical role in the education of a variety of disciplines and a variety of people, including the public, with our overarching goal is that we're ensuring appropriate patient care. We also, and this is kind of related to the education piece a little bit, we're also facilitators, and I've kind of commented on this a little bit, but ID pharmacists often serve as that bridge between evidence-based pharmacotherapy and applied patient care. So meaning that we're often the ones that are doing the deep dive into the literature, we're synthesizing and disseminating that information, and then proposing what changes we should implement to system-wide protocols, order sets, guidelines. And I will comment that you'll notice I'll speak a lot in terms of what it looks like in a hospital setting. And that, of course, is my own bias because that's where I have worked the entirety of my career. But this also applies into some more novel arenas that ID pharmacists are falling into, such as outpatient, driving patient care in the clinics and helping support providers to make sure that making the right decision is as easy as possible. And so having those supports, and pharmacists are often the ones that are driving those decisions to make sure that providers and patients and those that support providers and patients, nurses, et cetera, all have the information they need, again, to make the right decision be as easy as possible. And then besides facilitating that, those factors, which I think are probably take up the biggest part of infectious diseases pharmacist role, we also consider ourselves strong advocates. So we're looking for advocates for our patients. So we're looking to advocate new therapies. We're looking to advocate novel ways of administering therapies. Again, trying to make sure that we're complementing what the provider's expertise is and their diagnostic expertise. And I think too that along the lines with that, we're also advocates and partners with infection prevention and lab, again, to drive and diagnostic stewardship and infection prevention principles. And we're advocating for all of those things in a larger picture. The other thing we also do, and I would say is more common under the SIDP bucket, is that we do advocate for drug policy changes, recognizing that our antimicrobial pipeline is somewhat limited in the future and recognizing that we need supports in order to support additional advancements in the industry field. So we're advocates on the public policy side as well. And then finally, there are ID pharmacists that are in industry and are innovators of pharmaceutical development. But I would say any ID pharmacist is an innovator. They're looking at how do we make practice sites better? How do we creatively facilitate optimal patient care? And so we're looking to innovate how we do things on the hospital side, how we do things in the clinics, how we educate our patients. I think all ID pharmacists have an area of innovation as well. So again, we're looking at what is an ID pharmacist. We are stewards, educators, facilitators, advocates, and innovators. So, well, why do we need you? So why do we need an ID pharmacist? Well, I've touched on these a little bit, but really, when I talk about the career path of an ID pharmacist, you can see that really we are considered the antimicrobial and potentially vaccine and immunotherapy knowledge experts. And I think again, a lot of us think of pharmacists and they think of, oh, just making sure the dose is right. And we know a lot about the pharmacokinetics and pharmacodynamics with, absorption, metabolism, that kind of thing. And we're good at, intervening on drug interactions. But I would argue that infectious disease pharmacist goes way beyond that. And we are very much so the experts on spectrum of activity. We're looking at how to mitigate allergies, adverse effects. We're providing that direct inpatient care. And I think one thing that people don't always recognize that pharmacists, and especially infectious diseases pharmacists, will do is that we intervene on the level of what infection does this patient have and do they need antibiotics at all? And if we think they don't need antibiotics, that's something that we will intervene on to prevent that antibiotic prescription from the beginning. We're also, as I mentioned, collaborators with lab. And so we are heavily involved in diagnostic stewardship, making sure that our providers are able to use their diagnostic tests to the best of their ability so that we're not inappropriately interpreting those tests and inappropriately treating patients where antimicrobials may not be necessary. So we really provide a critical role in the terms of antimicrobial stewardship and preventing antimicrobial resistance. And as I mentioned before, my bias is always looking at the inpatient in the hospitalized setting because that's where I have worked for my career. But really, we are moving into optimizing antimicrobial use in a variety of settings. So, as I mentioned, inpatient, but also outpatient. So, outpatient antimicrobial stewardship, looking at developing programs at long-term care facilities. Transitions of care is a huge buzzword right now in how infectious diseases pharmacists can help facilitate those transitions to make sure that our durations aren't excessive, that patients discharging on IV appropriately is the right thing to do. And so there's a lot of a variety of settings in which infectious diseases pharmacists are working or will be working in the near future. And the other thing too, keeping in mind with the advent of telehealth, and especially over the last few years with virtual medicine, we are reaching into more rural and underserved areas as well. I already touched on this a little bit, but pharmacists are critical in the research and drug development field, whereas there's a key role of pharmacists in the pharmaceutical industry in the development of the drugs and then in the dissemination of the education after those drugs come to market. We look at, I think another important thing is quality of care, and I've already alluded to this already, but if you look at a lot of the protocols, guidelines, quality improvement studies, the development of best practices in institutions, a lot of that is driven by pharmacists. But I should not underscore the amount that we do collaborate with our provider partners and especially our infectious diseases providers who are critical in a lot of this as well. And then finally, I mentioned education and public education and public policy. We're often very involved in here, and I'll be touching a little bit more on those a little bit later, especially when I talk about SIDP. So for those of you that don't know me as well, I will just to give you a reminder, I guess, or a summary of who I am and how I've gotten to where I've been. This is my career trajectory. So I did 3 years of undergrad at North Dakota State University and then went on to do 4 years of pharmacy school, also at NDSU. And then went on and did my 1 year pharmacy practice residency, so the general pharmacy practice residency at Abbott Northwestern, followed by my infectious diseases pharmacy residency. I then was 5 years as an infectious diseases clinical pharmacy specialist, so, an infectious diseases pharmacist role. And then for the most recent 8 years, I was an ID clinical pharmacy coordinator. So stepping into a little bit more of a leadership role, again, back at Abbott Northwestern. And now most recently, I just stepped into the system antimicrobial stewardship program manager role. And under this role, I'm helping facilitate and as I mentioned in my bio, strategize the larger goals and initiatives and strategic plan for the Allina Health System, which is a 12 hospital, 90 plus clinic health system in Minnesota and Wisconsin. So you can see this is, I would say, a somewhat more typical career path of what an infectious diseases pharmacist might look like. But as I mentioned, there are other ways and other avenues as well for infectious diseases pharmacists. So let's switch gears a little bit and talk about SIDP, which is really one of the main reasons why I'm involved in NIAMRRE. So SIDP was founded in 1990 in Illinois, and we are a nonprofit organization. And we're an association of pharmacists and other allied health professionals committed to promoting the appropriate use of antimicrobial agents and supporting a lot of the things that I've already talked about, including clinical practice, teaching, and research. So our membership and reach has grown significantly over the last 30 years. And just to give you a brief kind of high-level statistics of what SIDP looks like right now, we have over 1,700 members right now. Our membership come from those practicing in the hospitalized setting, academia, industry, and government organizations such as the CDC. We have members from across all 50 states and including international members. We have roughly 480 some members that are not pharmacists, so that can include physicians, public health, and nurses that are included as associate members of SIDP, but voting members are pharmacists. And we have about 80 international members, so 80 international members. So we have grown significantly over the last 30 years. On the bottom right there, you can see our distribution of practice settings. And I can mention that, as I mentioned, the majority work in the hospital, but we do have a significant percent that work in academia, industry, etc. We do have a substantial social media presence right now as well, with over 26,000 followers on Twitter, or I guess we call it X now. And we also have presence on Facebook, LinkedIn, and Instagram. So what is the mission and vision of SIDP? So the mission is to advance infectious diseases pharmacy and lead antimicrobial stewardship. Again, this is primarily in the human healthcare side of things, so keep that in mind, in order to optimize the care of patients with infections in every practice setting. Our vision, and I think this is a collective vision that I think we can all get aligned with, is that we have the vision for safe and effective antimicrobials for now and the future. The core values of SIDP are to empower, innovate, and embrace. And we look to really challenge, empower, and mentor our members to really achieve the highest levels of professional excellence. So as I mentioned before, there are multiple ways in which a pharmacist can enter an infectious diseases pharmacist position. So our goal is really to empower them to do that job to the best of their ability. We're also looking to innovate, and that's, not only creating with new ideas on our own, but collaborating with others, with our partners in providers and infection prevention and lab, really to create solutions that help advance responsible use and improve patient outcomes. So making the right choice as easy as possible, implementing novel ways of administering antibiotics, implementing new ways to tackle transitions of care. Those are the things that we're really looking to support as an organization. And then finally, we really look to embrace and promote a culture of integrity, diversity, equity, inclusion, and beneficence. And looking at the number of international members, et cetera, we're making sure that we are keeping a holistic and global approach when we're looking at advancing the mission of SIDP. So here is SIDP's strategic blueprint, rather. And we already talked about the mission, vision, and core values that are at the top there. So I'm just going to talk about our 6 main priorities right now as an organization. One of our first priorities is communications. And I think a lot of that helps advance our mission, but also facilitates internal and external engagement. So making sure our members have avenues to be involved, that they have avenues to share their ideas, but then also that we can expand our internal and external communications to broaden awareness of infectious diseases pharmacists in general, and also expand the awareness of the opportunities that members have within SIDP, whether or not you are a pharmacist. The other priority is advocacy. So I think this is an important one and is a pretty broad umbrella, but we're looking to develop a strategic policy platform to move forward with advocating infectious diseases pharmacy practice in general, but also research and antimicrobial stewardship, looking at advocacy in industry, looking at advocating for additional education for providers, for pharmacists, for patients. And then again, that, research is a big promotion here as well for advocacy. So we want to have this coalition building across the profession and across the multidisciplinary fields as well within infectious diseases and beyond. Third priority listed here is education and practice. Definitely have expounded on this already a little bit, but we really want to develop a very diverse, effective, and high quality portfolio of educational programs. And I'm going to touch on that a little bit, the different avenues that we have for education within SIDP. And we're hoping that not only advances our profession, but also contributes to the knowledge of the healthcare community and the public. So we're looking to expand our educational pipeline, which I think is a very aggressive goal when I'll tell you all the different avenues that we do provide. But we also want to look at additional interprofessional educational offerings. And then we actually just revamped our antimicrobial stewardship certificate program, again, making sure that it is as cutting edge and as value added as possible for people stepping into antimicrobial stewardship positions. Research is another priority. So we're looking to promote and support innovative research. And again, that doesn't necessarily need to be just in treatment of infectious diseases and infectious diseases pharmacotherapy, but looking at supporting research in antimicrobial resistance and antimicrobial stewardship with the ultimate goal of improving patient outcomes in whatever way we can. And so we're really looking to facilitate those research collaborations and mentorships within the organization. Membership and society operations, I'll just touch on very briefly, but obviously we're looking, as I mentioned before, actively engage our members, develop them as leaders. We are a very large organization, so really increasing that connectivity across membership is important. And then we're also making sure that we are highly effective, efficient, and financially self-sufficient. So financial sustainability is also a key priority of SIDP. So what I won't do is, you don't have to necessarily take my word for it. I may be the first infectious diseases pharmacist, or maybe a lot others, but we have several videos on the SIDP website. And if you want more information about SIDP in general, I encourage you to go to the website at sidp.org. But the videos we have on there include who we are, which I'm going to show you guys here in just a minute. And Chris, when I play this, you just want to make sure to give me a wave or a thumbs up or a verbal confirmation that you can hear the video. I should have been able to make that work. I'll be playing that in just a second, but then we also have other videos about just what is the pharmacist's role in combating antibiotic resistance, and then patient-facing videos about talking with your pharmacist about antibiotics. So we have a lot of different videos that we have available. So again, you don't have to take my word for it. I'm gonna quick play this video right now for you, and you'll be able to hear from some other infectious diseases pharmacists from across the nation.
Founded in 1991, the Society of Infectious Diseases Pharmacists is an association of pharmacists and allied health professionals dedicated to promoting the appropriate use of antimicrobial agents. The mission of SIDP is to advance infectious diseases pharmacy, lead antimicrobial stewardship, and optimize the care of patients with infections. We're the professional home for a lot of different roles that ID pharmacists play. For people who are in academics and teach future pharmacists, for people who are at the bedsides, we are stewards, we are researchers. There's no other concentrated home for everything related to ID pharmacy.
The resources that SIDP provides is a lot of networking opportunities.
And opportunities to innovate or to develop new ideas.
If I can say one thing that's been really the most valuable experience of being an SIDP member for me, it's been the relationships I've built with other pharmacists.
It's a good networking opportunity to bring together different infectious diseases pharmacists.
Over the years, I got my first research grant from the Society.
It provides a wide range of educational programs, board certification, preparatory coursework, and even podcasts by experts in their field around the country.
I help community hospitals.
A lot of my role is dealing with patient care.
Most of my time is spent working with the lab here.
I've helped develop new drugs and been very involved in getting these new drugs to patients while they're still under investigation.
I work on our antimicrobial stewardship team, where we provide high-level oversight to how antibiotics are used throughout our whole hospital.
I am an antimicrobial stewardship pharmacist. So antibiotic stewardship, in the most simplest description, is optimizing the way we use antibiotics. Because we know that every time we use antibiotics today, it is not a given that we will be able to use that antibiotic in the future.
Stewardship not only takes care of the patient at the bedside and makes sure that that individual patient is on the right drug, but also looks at, are we using antibiotics responsibly across the larger healthcare system?
Pharmacists today are leading many types of research in antibiotic stewardship.
Whether they be clinical and hospital-based, things about patient care, or even the tools that we use to identify certain infections.
I do a lot of research on antibiotic allergies.
Our lab spends a lot of time really just figuring out how much of an antibiotic is somewhere. If you have an infection that goes into the brain, how much of that antibiotic goes into the brain?
The things that we're doing craft guidelines. So when you hear that there is a drug of choice to treat an infection, that's because there was research done, often either led or co-led by pharmacists. We're very involved in advocacy for our patients and making sure individual patients get the therapies that they need, but also advocating to make sure that new drugs are developed for the public.
We have made it an important mission to come up with education to the public, what they should be thinking about for COVID-19, how they should be approaching vaccinations and things like that.
One of the big things SIDP does is continue to fight for a seat at the table for infectious diseases pharmacists. The organization has really grown exponentially in the last 30 years. We've partnered with other organizations recently, including the Infectious Diseases Society of America and the Society of Healthcare Epidemiology of America.
They're very engaged nationally as well as internationally. They're helping to set policy. They're interfacing with groups such as the FDA. We have pharmacists that are involved in research to find tomorrow's cures for the infections that we do not know yet exist.
SIDP's vision is safe antimicrobials for now and the future. It's really important to the general community because part of what the ID pharmacist does is they help minimize overuse of antibiotics. And so we have to make sure we're using the right antibiotics to treat the patients we have today, but we're also preserving them for the patients in the future.
All right. I hope you enjoyed that video. It's a little outside or alternative perspective to what I was talking about today as well. And before it goes again, we'll move on to the next slide. I'm going to go just through, again, some additional information about SIDP and some specific examples, and then we'll definitely open it up for additional questions that you have. But, you know, SIDP being a 1,700 plus member organization right now, we do have a lot of subcommittees that people can be involved with. And I'm not going to go through all of these right now, but you can see how SIDP organizes itself into different buckets and then different subcommittees under those individual buckets. And I think you can see from the discussions that we already had today, how these align with the bigger goal and mission and vision of SIDP. So I'll point out just a few there, but I was involved for many years in the Policy and Government Affairs Committee. I've also been involved in the Recognitions Committee, but there's a lot of different committees that, again, help support SIDP's mission and vision of increasing our advocacy, our membership and outreach, our communications, research, and then education. So some key initiatives looking into 2024 and beyond. Again, I commented on this already, but we're looking to advance our educational portfolio, continuing to advocate for our profession, and then continuing a culture of community. So I'm going to give a brief snapshot on some of the clinician education that we've had, which I've mentioned several times now is a big focus of SIDP. But you can see in 2021, we had more than 11,000 enrollments in our educational platforms, and a lot of those being in the Antimicrobial Stewardship Certificate Program. And that, as I mentioned before, is a way to train up and mentor our pharmacy leaders into antimicrobial stewardship leadership, looking at different certificate programs for both acute care, long-term care, and we now also have one for pharmacists that practice in low and middle income countries. We also have a very popular Breakpoints podcast, and I'll touch on that in a little bit as well, which you can get on any major podcast provider. And that's it. Tell you, it's such a fun podcast, and there's no doubt why it's so popular. We've had really interesting topics recently too, looking at even doing antimicrobial stewardship in times of war, where we interviewed and had some perspectives from those in Ukraine. We've had the most recent podcast that was just released was looking at dosing of metronidazole and recognizing that 3 times daily is probably no longer necessary, and why. The other things that SIDP offers for education, so there's a Society of Infectious Diseases Pharmacists Education Center, or SIDPEC. That's where a lot of us, myself included, get our continuing education credits in order to maintain our VCIAP certifications. There's journal clubs that we have, and I will say the focused antimicrobial stewardship training were 1 day kind of concentrated training events that are paused at the moment as we're focusing on other ones. But you can see we've really had a pretty large array, of educational offerings that SIDP has put together. Now, so not only do we have those educational offerings that are strictly within SIDP, we also have multiple avenues of publications, and I'll include a little highlights here of some of the podcasts as well. But within SIDP, we have a quarterly newsletter, again, to help our membership know what's going on. We had the Breakpoints podcast, which I talked about a little bit already. Some quick, interesting stats on here is that we've had well over 350,000 listens. I think this statistic is actually a couple of years old, and we just came out with the 88th episode, as I mentioned, and we've had listeners from over 105 different countries. We also have publications that are done either on behalf of SIDP, or they're called insights from SIDP articles. Some recent ones we've had on there are describing the role of infectious diseases pharmacists in antimicrobial stewardship programs, looking at social media and the impact on infectious diseases drug information. And what I'll talk about a little bit more that I was able to be involved with was that antibiotics in agriculture paper. But you can see there's a wide array of topics that SIDP has been able to publish on. We also have the Bench to Bedside with SIDP column within Contagion Live, in which we have 6 columns per year on that online platform. We also have a partnership with Pharmacy Times as one of their industry leaders, in which we help publish 6 articles per year in that pharmacy-specific journal. But then we also have new SIDP editors within the Journal of Antimicrobial Chemotherapy, AMR journal, and the Antimicrobial Stewardship and Healthcare Epidemiology journal as well. So really expanding our reach both within and outside of pharmacy when it comes to publications and other methods of disseminating information. We're also a partner with ID Week. So we are now an official partner with Infectious Diseases Society of America, and that's what we are, a sponsor of this very large conference that I'm sure a lot of you are familiar with. SIDP is an official partner there for ID Week. We also are really expanding our inter-organizational engagement. So I thought I'd touch on that very briefly, especially me being here today. But we have collaborations with dozens of organizations, including this one, but also the Pharmaceutical Forum of the Americas. We have collaborations with CDC, SHEA, IDSA, ASHP, which is the American Society of Health System Pharmacists, ACCP, which is the American College of Clinical Pharmacy. So we have a lot of different inter-organizational collaborations right now. And we also utilize this collaboration to help support the National Infectious Diseases Pharmacy Day, which is May 22nd. So if you hear information about that, know that a lot of that is supported and driven by SIDP. And then I'll just touch on really quick about our public outreach. So we've been really trying to expand our offerings here as well. We have an educational handout for pharmacists and providers, and to help with our antimicrobial stewardship advocacy toolkit. So if they don't have a robust antimicrobial stewardship in their institution, we've put together a toolkit to help them really advocate for that and help them drive that change in their institution. We have educational handouts for the public, as I mentioned there. We've drafted a One Health webpage, and we have an annual ID Pharmacist Day, as I mentioned as well. That is, helps with the public outreach. One other thing that I haven't touched on too much, but I wanted to touch on a little bit quickly are the guidelines that SIDP and ID pharmacists are involved with. So we coordinated with external stakeholders for SIDP endorsement of guidelines. And in 2022, we reviewed more than 15 IDSA COVID guideline updates. So we're official reviewers on those. We reviewed 5 guidelines, 4 for SHEA and 1 for ACCP for SIDP endorsement. Those are listed there. And then we also work to enhance the SIDP representation on external society guidelines. Again, advocating that infectious diseases pharmacist perspective is very valuable in some of these guidelines. Some brief advocacy highlights. In 2022, we co-signed 15 statements and letters with strategic partners and organizations, reviewed and provided public comments on the Center for Medicaid and Medicare Services guidelines and standards. And we also have an advocacy agenda on antimicrobial development. Research, we do fund numerous research and educational projects annually, and I've alluded to that as a strategic priority, but I wanted to give some quick specific examples here. So for example, we do have awards that are given out for the Early Career Research Awards. Those have include looking at pharmacokinetics and pharmacodynamics of fixed dose daptomycin or therapeutic drug monitoring guided linezolid dosing. We've also had educational grants looking at supporting informational videos on infectious diseases pharmacists for undergraduate and new pharmacy students, kind of promoting our profession. And then we've also had a DEI research grant that went to something called Project Play, which was pharmacist-led PrEP education in young adults. And then the one last specific example I wanted to give today before we transition into a Q&A is that the paper that I really enjoy being a part of, and I think aligns well with NIAMRRE strategy and with One Health initiatives in general. But we published the Antimicrobials in Animal Agriculture in the United States paper is shown here. And we're really proud of this article. And I encourage you, if you're interested in this, to go ahead and look it up. But we really included a multidisciplinary authorship, looking and having, including a veterinarian, including someone in animal agriculture, to really help describe where we are at with using antimicrobials in animal agriculture, so that people can have a better understanding of current status, what challenges there are to antimicrobial stewardship, and then how they can be better advocates. And this really was looking at the perspective of what do people in human healthcare, and especially infectious disease pharmacists, what do you need to know? How do you need to be a better advocate so that we can really collaborate better with our partners across the One Health spectrum? Looking beyond, so this year and next year for SIDP goals, I touched on these a little bit more, but we're looking to implement our educational plans, so expanding some of those offerings, as I mentioned before. As I mentioned, there's a lot of different avenues for people to move into infectious diseases pharmacy positions. There are also a lot of different career paths in general. And so looking to have the results of a workforce survey published so that the broader audience can understand where are infectious diseases pharmacists right now and where are they working. Looking to support a research platform. I already touched on organizational collaborations. We're also looking to really grow our international membership and our student growth. And then we're also initiating in 2024 an international task force. So again, really looking to increase our reach worldwide. So in summary, ID pharmacists are critical to the mission of combating antimicrobial resistance and optimizing patient outcomes. SIDP is an active and growing organization of over 1,700 members in diverse practice settings, and we're really providing that pharmaceutical expertise. We're helping with research, we're innovating, we're providing education, and we're supporting other healthcare providers, pharmacists, nurses, the public, and more. And our vision, and I'm sure all of your vision, is to have safe and effective antimicrobials for now and the future. I wanted to quick acknowledge Melissa Johnson. She is the immediate past president of SIDP, and a lot of these slides were borrowed from her. So I made sure I had the most up-to-date information I could have to share with you guys. So I just wanted to acknowledge Melissa and her letting me borrow her slides.
Great. Well, thank you, Krista. That was a wonderful presentation. So nice to hear about your career path and then learn so much about SIDP and the impact it has. I'll invite our audience members to go ahead and put questions into the Q&A function. We do have one in there now. And it sounds like you work towards changing behaviors as an ID pharmacist.
Mm-hmm.
Do you get training in your educational programs on behavior change or education strategies?
Yes, that is an awesome question. And I would say we do, but we could get more. And I would say, looking into behavioral science is kind of my new side passion right now. And honestly, this organization was really helpful for me in getting more connected with that field of research. And at the annual meeting last May here is when I heard some speakers such as Courtney Price talk about behavioral science. And I think that's such an amazing field of research that positively impacts what we do and what we're trying to do. And I'm actually hoping to give a talk coming up in March here on just that, things that I've learned from behavioral science research and how we can apply that to antimicrobial stewardship, because I think that's such a huge field of research and has so many applications in antimicrobial stewardship. So thanks for bringing that up.
Yeah, great question. So we've got a couple more that have come in. The next question is, if someone would like to collaborate with an ID pharmacist, what would be the best strategy to get connected with one?
Yeah, that's a great question. So, it depends on, I guess, where you work. I would say most hospital institutions these days are becoming more uncommon that they will have an ID pharmacist. But if you are unsure, SIDP is a great way. So we have you can either contact them directly and then they can get you connected with a pharmacist that might be well suited or connected in your area to help work with you. So I would just encourage you to, if you're not sure to who to reach out at your institution, reach out to SIDP. They would be happy to connect you with someone.
Great. The next question we have, and again, I think this is the last one we have in the queue, but I have some if no more come in. So great presentation. In your opinion, what are the biggest challenges for someone who is starting a career as an infectious disease pharmacist?
That is a great question. I think right now, the first thing that comes to my mind right now is actually the behavioral science piece. And I think we become pharmaceutical experts, but if we are unable to effectively communicate our knowledge and or communicate it in a way that actually drives change or changes behavior, then, it's really, I would argue, our information is not valuable, useless. If you can't communicate it well, and if you can't drive that behavioral change, that is a huge component, which I think is a challenge for a lot of people entering into the field. When you go through that residency training, a lot of it is really focused on the clinical side of things, less so on the behavioral change side of things. And I think having that emotional intelligence is sometimes something that people struggle with when they enter an infectious diseases pharmacist position initially.
Yeah, and I think that probably cuts across sort of all the health professions and animal health. That is, as you mentioned, that's something we all need to focus on is understanding how to influence and change behaviors. So I don't see questions coming in, but I had some questions. So I was curious to know whether there are new tools that you're excited about that are coming online for stewardship programs.
That's a great one. There are a few things that kind of come to mind, and some of the more, I guess I can think of kind of three big buckets that I think are kind of exciting right now in infectious diseases and stewardship pharmacy. I think the expansion of tools to appropriately evaluate allergies. And so most of this research is within penicillin allergies, but that's definitely a new and upcoming feature right now of a lot of stewardship programs is implementing those clinical decision tools to help analyze allergies and potentially delabel patient with allergies. The other big one that I think about is just not only technology in general, but I think a lot of stewardship programs are getting much more astute with mobile applications and clinical decision support. So we instituted a mobile app within the Atlanta Health System and got a lot of great feedback right now from that. But there's even more stuff coming on the pipeline, which I don't feel like I'm the expert on, but I know there's going to be more things like with artificial intelligence. And I think that avenue of technology is just going to be exploding in the next 2 years. And then I think the other one is implementing outpatient antimicrobial stewardship. That has kind of been the wild west up until now. The inpatient side, it's easier because you have a captive audience, right? If I want to change the antibiotic, I just contact the provider, or I can do it sometimes myself via protocol and just change it. But outpatient, the patient's not there anymore. They already picked up their script, and it's much more difficult to do, arguably, to do stewardship in the outpatient setting. And so there's a lot of new advances there and how we're tackling that.
Yeah, those all sound really exciting. So in your opinion, do you think the need for infectious diseases pharmacists is going to continue to increase? And I know there's some underserved areas. I think at the World AMR Congress meeting a couple years ago, we heard that something like a third of the counties in the US don't have infectious disease docs. And so we know that ID pharmacists are very important parts of that healthcare team. So how do you see this changes in kind of the workforce here in the future?
Yeah, for sure. I mean, I think if we learned anything from COVID too, was how valuable infectious diseases pharmacists were in that. And I can add that was probably a challenge for ID pharmacists in our career, was preventing that burnout during epidemics like that. But I think for sure the need for ID pharmacists is going to increase, and utilizing and reaching out into rural and underserved areas is going to be something that's going to be front and center going forward. I think the challenge that will happen though is that pharmacy school enrollments are actually down across the country. And so there is definitely a concern for pharmacy workforce shortages as well, like everyone else I feel like is challenged with. So I can see definitely where sites maybe will identify a need for an ID pharmacist, but will struggle to find one. And so I would say it's a good career to step into right now, as there's a lot of interest and need. But I hope I'm not sure that the supply will keep up with the demand in the immediate future anyway.
Yeah. Yeah, again, a lot of workforce challenges kind of across the whole One Health spectrum. And so I kind of a quick last question before we wrap up here. And you alluded to this a little bit earlier, but you talked a little bit about how you interacted with the team and how ID pharmacists work in hospitals, and we saw the video. So was interprofessional education a formal part of your infectious disease pharmacy training?
Yeah, I would say for sure. We when I went to school, we actually had some classes that overlapped with other healthcare disciplines. Arguably undergrad too, because as you went through stuff like organic chemistry and that kind of stuff. But we had in pharmacy school, we had classes that overlapped with other professions in the department. And I would say most of it though, and most of where I got a taste of the behavioral science piece and those interdisciplinary collaborations was in my second year residency. And learning, that second year residency not only is hammering home the clinical knowledge and information you need, but it is also hammering home those leadership skills and how do you, as a pharmacist, give this unsolicited advice sometimes, and how do you do that in a way that doesn't make a provider defensive, in a way that isn't confusing to the patient. That is where I got most of the training. And then honestly, over the last 13 years, I've made enough mistakes to learn enough as well as I've gone through just with my experience as well. But we do get some of that, but I think there's an opportunity for more as well as we're looking into the need and projections of the future of the need for ID pharmacists in that training.
Great. Well, I don't see any additional questions in, so I'll say thank you again for a wonderful presentation. And I'm going to share just a couple more slides as we wrap up today's member spotlight. So let's see here. Let me just skip through these. So just a reminder, we do have dates for our 2024 NIAMRRE Annual Conference. It'll be held May 14th through the 16th and at the Blackwell Inn and Fall Conference Center in the Ohio State University in Columbus, Ohio. So we're excited about that. Let's see. Thank you, Krista. I highly recommend the annual conference. Yep, we're very excited.
You there, but yeah, I went last year and it was fantastic. So I just really encourage people to go.
Yeah, thank you. Yeah, we're planning a very similar format, and I think our theme this year will be bridging gaps in AMR, and we're excited about what the agenda is looking like, and excited to have it hosted at OSU. And so with that, I think, again, thanks everyone for their participation. Krista, thank you again. Really enjoyed hearing more about your background, and really impressed with the work that SIDP does. And we'll look forward to hearing from you in the future, and to seeing the impact that SIDP has on AMR going forward. So thanks, everyone.
Thank you. It was a pleasure.